I'm so excited to be here at Calamityville today because our students gain so much from these kinds of experiences.
At the end of the day, what we really want them to take away from is having an understanding of what happens in a disaster.
You know, noises, distractions, people coming up to you yelling.
Screaming and yelling, and people don't know what's going on. There's confusion, there's chaos. Complete chaos. Chaos. Chaotic. Chaotic.
My name is Philip Smith. I am the technology coordinator in the Simulation Center for Kettering College Division of Nursing. And my job primarily is to maintain and run the technology in the Sim Center, like the mannequins and things like that. But in addition to that, I'm also a paramedic. And so I get to participate in the disaster sim that we do for the students. This is an opportunity for them to get out and see a different perspective on nursing. Because in a disaster situation, you have nurses working with paramedics, but we all have to be able to work together. And so this is a good opportunity to give them a chance to see what that's like without it being a real disaster.
Simulation in itself is a safe environment for students to learn to do any kind of healthcare in a safe environment where they can learn even if they make mistakes. In a disaster situation, the possibility of making mistakes is even greater. So having a place where students can learn in a safe environment how to deal with organized chaos, which is what a disaster is when we come to help, is an extremely good experience. They will at least know the basics and can help out when they see even a minor thing like an accident at the side of the road, which is a disaster, a small disaster in itself.
You know, books are one thing, but experiences, especially hands-on, that's how I learned. So it was a great experience.
I think it's a great experience that everybody can get that kind of a little bit of a stressor, and then they have to kind of critically think through the process to kind of work towards the ultimate goal, which is, you know, saving and getting as many of those lives that we can, and helping those that do need it. So. But yeah, it's been a great experience here. I wish I got more opportunities to do it. Hopefully, you know, maybe I can kind of come back and help out with it, because I think it's just a great base knowledge that you know, everybody needs to know, whether or not you're civilian or healthcare worker.
My role was pretty much helping with the moulage, which is basically putting makeup and preparing the scenario and our victims to be more realistic possible. We don't pretend to be Hollywood, but at least we create some distress opportunities for the first responders when they come and see blood and see wounds and, you know, exposed bones, things that may happen in the real life. So with that, create a realistic scenario, and also the opportunity for them to develop that empathy and that connection with the persons that they are attending.
Just like anything, we can only prepare so much for the real thing, but I think it gives them an idea of like what their role might be, and how that they just have to really think on their feet and to prioritize, usually using their critical thinking and always just reassessing the situation, because patients can change in a drop of a dime.
I was able to help triage patients. I had to determine which ones should be seen first versus who was okay, and it was really hard because as a nurse, you're trained to look beyond what you can see physically, but in a disaster situation, what you can see immediately and treat immediately is most important. And I think it was really good to help us to get in that headspace, and it was super fun.
In general, it was really good to kind of see the care and how everybody just dictated where to go, how to do certain things. So all in all, it was a great experience.